Hi, my name is Bianka Forgo, and I am a trainee in Neuroradiology at the Department of Neuroradiology at Karolinska University Hospital in Stockholm, Sweden. And today I'm going to talk about a topic that will be really relevant as we see how diagnostic MRI is evolving in brain tumor imaging. And this is about longitudinal segmentation and a little bit about segmentation in general. So here's the outline of my presentation. So we are going to talk about the goals of the segmentation to start with. What is segmentation? Different segmentation methods, and finally, some longitudinal pipelines for analysis of brain tumors. So what is segmentation? Well, segmentation is a technique which we use to partition different tissues. And why is that important? Well, as you can see in this image, where you see a brain tumor in the left temporal lobe, the tumor has different characteristics, different parts. You have an enhancing region, just as you can see it right here on this T1 weighted image after contrast. And you also have non-enhancing regions that manifest as T2 hyperintensities. Now, when we do segmentation, we sort of want to delineate these structures and partition the different parts of the tumor. And we will end up with something like this. So suddenly we have different parts of this pathology delineated. So what are our goals when we segment brain tumors? Well, we can use segmentation for research as well as for clinical tools, and the two, of course, have a very strong connection. In research so far, we have been using segmentation as a base for the different biological molecular features of these brain tumors. And the reason that we do that is that we would like to examine these tissues and the different molecular, genomic, biological characteristics because these have to do with the patient's prognosis. We may perform texture analysis and extract quantitative features such as cerebral blood volume, for example. And a big advantage of segmentation compared to measurements compared to manual measurements is that we can this way look at the entire tumor, the entire pathology. And of course, we desire to do this and we do it in a non-invasive way. And ultimately, what we use segmentation for is to sort of provide a good basis for different artificial intelligence methods that will give us these features of the pathology. Clinically, we use it as we advance towards precision medicine, and of course, we use it for surveillance and prognosis assessment, which are the most important things when it comes to longitudinal segmentation pipelines, going more towards non-invasive diagnostics as opposed to invasive biopsies, for example. So there are different ways we can do segmentations. Obviously, the manual delineation of these structures is a tedious, time-consuming procedure and has a lot of inter-rater variability. Semi-automatic segmentation methods are based on an automated part, and which will be then manually corrected by the user. And we obviously have automatic segmentation methods, which mainly use convolutional neural networks. The desired features of these segmentation methods are reliability, reproducibility. They are fully automatic, and an important criteria as a quality control of these methods is the dissimilarity coefficient, which is desired to be above 0.8. Now we're going to talk a little bit about semi-automatic segmentation. So actually, we work also with Sercare Medical and with their platform, and we are actually conducting a project where we are externally validating an automatic segmentation method. And in order to do that, we perform semi-automatic segmentations by 2 readers. And we would like to see how the automatic algorithm works both on a voxel and the region of interest level. Here you can see the specifications of this automatic pipeline. And here are just 2 examples of the semi-automatic segmentation, so the ones that are used for the external validation. The steps that are involved are the following. So in order to get these images, you will need to first take the T2 weighted flare image and the T1 weighted image after contrast, and these are co-registered, so in the same space. Then we assign tissue classes, and so we give the software examples of the different tissues that will then be incorporated and used by a machine learning algorithm. And as a result, we get a pre-segmentation, which looks something like this. So we get a delineation by the software of these different structures, in this case the necrotic cavity, and we put a seed in it, which then ultimately will grow, and as a result we get these images. We do these steps for all the tissue classes that we desire to include in the segmentation map, and what we typically do is what we typically include is the contrast enhancing tumor, the non-enhancing tumor or edema, and the necrotic cavity. Some pitfalls that arise when we do semi-automatic segmentations. So we often struggle with blood products because these can be of low intensity on T2 weighted images, and they can also appear as high intensity areas on T1 weighted images. So that will be a confounder on the T1 weighted image after contrast. And so that is one issue that is quite difficult to resolve. And also we have to remember that there can be multiple tissue classes in the same voxel. So the same voxel can include contrast enhancing tumor and some blood product and some protein and so on. So it's just important to keep it in mind. Also, we can have adjacent structures which have similar signal intensity as the enhancing region. So we have to sort of manually then remove those areas of the segmentation map. And finally, we can have other pathologies that appear similar to the given tissue class. For example, white matter hyperintensities are typical examples of this. So they can appear as the peritumoral edema or non-enhancing tumor. And now we're going to talk about the longitudinal analysis pipeline, which is also it's a work in progress, but it's also something that we have been working on with Sercare Medical. So why do we need a longitudinal analysis for brain tumors that use these automated segmentation methods? Well, obviously, the course of the enhancing and non-enhancing regions of the tumor determine the patient's overall survival. So that it's a very important prognostic information in clinical practice. We would like to see if, for example, if a patient has a tumor which is, for example, grade 2, so not the highest grade, we would like to monitor and see if that tumor will evolve into a tumor of higher grade, because that also has to do with the patient's prognosis. We would like to monitor the response to treatment. And for this, we use the RANO criteria. When it comes to RANO criteria, we are most interested in contrast enhancing tumor size, and we will quantify that as shown in this table here. So we are interested in the percentual increase or decrease of the contrast enhancing tumor. We are also interested in the non-enhancing tumor size. However, here we are restricted to a qualitative information. We are interested in new lesions or new contrast-enhancing lesions that appear. And also, we would like to monitor pseudoprogression, which can be typically seen after a few weeks, months after irradiation. We would like to differentiate this from true tumor progression, because also that has obviously a very significant impact on survival and also on therapeutic decisions, obviously. And we would like to monitor pseudo-response, which usually is observed in patients who get anti-angiogenic agents. So here is an example of the longitudinal pipeline. So here in the left, we can see a patient with a contrast-enhancing occipital left-sided tumor. And as you can see, with this longitudinal analysis, we can sort of put these images next to each other using the same slices or similar slices, and to segment the contrast-enhancing regions, as well as the edema is delineated here, is segmented. We also get a very nice quantitative information of the different tissue class volumes. So as you can see here in blue, we can see how the non-enhancing tumor is first decreasing and later increasing in this patient. And similarly, in green, we can see the enhancing tumor first slightly decreasing and then increasing. It's very important information for us, and it's a very nice way to sort of visualize the tendencies, because when we just measure using just some linear measurements in 2D images, it's quite difficult to be precise, and to sometimes it can be quite difficult to actually conclude whether the tumor has increased or decreased. And here we can get very precise measurements, and also, as you can see here, the tendencies are indicated. So if the tumor volume is decreasing, then you see like a small green arrow pointing downwards, and when there's increase in volumes, you can see a red arrow pointing upwards. Here is another feature that is coming with the longitudinal pipeline that is, again, a work in progress. So we will be able to also do longitudinal quantifications of cerebral blood volume. And as you can see, you will be able to get the ROIs and the curves corresponding to enhancing and non-enhancing tumor regions. Here's another example, a patient with a left-sided temporal tumor. And in this case, you can see very clearly how after operation and therapy, both tissue classes are decreasing. And it's not so difficult to see maybe on the first postoperative image that we have a decrease in these enhancing and non-enhancing tissue classes. So we are talking about this middle column of images. That's the first postoperative image. However, it can be quite difficult to actually compare the following image to this middle one, because the changes are very tiny. So in order to make a correct judgment, this is a really helpful tool to use. And so here are my references, and thank you very much for your attention.